There's nothing wrong with dermal fillers. There's nothing wrong with using them. It doesn't make you artificial. It doesn't make you vain. It's taking care of your skin and having healthy aging. You just need to go to an injector that shares your personal take on fillers and aesthetics.
You're listening to Just a Pinch podcast with Injector Kristin. Join me and industry experts as we discuss the good, the bad, and the ugly of the aesthetics, wellness, and fitness industries.
Welcome back to Just a Pinch podcast. You are here with me today, Injector Kristin. And today's topic, we're going to be chatting about dermal filler. Where's the filler going? Is filler out? Was it just a trend? Why are we seeing everybody dissolving their fillers? You look around on social media, you see celebrities changing the way that they're looking, coming out and talking about how they have dissolved their filler and are going more natural. Is it just what we're seeing, or is it a real phenomenon? So based on the data, filler is still up 70%. So it's not going anywhere, but we are seeing different trends changing in the world of fillers. So everywhere you look, people are dissolving. Why? That's the big question that we have to ask ourselves. Why are people now choosing to dissolve their filler? Well, there's a few reasons, and one of the main ones that I think are trends. And I'm going to do a whole nother episode on trendy filler here and aesthetic trends. But truly, trends within filler injection styles, the same way that our clothes come and go out of style, there's been changes in how we feel about our filler and our aesthetic outcomes. When the Kylie lips were really big and she had big juicy lips, and the celebrities were really over injected and were going for more dramatic looks. So sculpted jawlines, females were getting really masculinized jawlines, pointy witch chins, really sculpted cheeks, overfilled and puffy, and lips like bigger than what your lips can handle. Those are trends, and those trends tend to fade. And with time, people have realized that some of those trends really don't age well. And so then they realize they can do something about it. So time to go in for some dissolving. Kylie notoriously went in and dissolved down her lip. She didn't fully get rid of it, but she took it down a notch. And a lot of different celebs have been doing that. And you see their changing faces over time and now going a little bit more natural, which is a great thing in my opinion. Now, another reason why people are dissolving their filler is because it's old filler. Filler has now been out for, decades at this point, and some people are at that age where they've been getting filler injected year after year after year after year, and it's time to clean house. Some people never need to go through the dissolving process, and other people do. All of our bodies are very different with how we metabolize and break down product. It also depends on who's done your filler injections, how your body has reacted to those specific products, and where you got it done. Some notorious areas that usually need the most dissolving is under eye. So tear trough filler, I'd almost put that at number one over lips, but we just in general do more lips, so lips will always be number one. So under eye filler, lip filler, those are the two main ones, because when it goes bad, it is so blatantly obvious because it's a small contained area. Under eyes get lumpy and bumpy and puffy, might be kind of a blue color to the under eye, may wake up really swollen every morning and then have to wait for that to go down. Lips, it is blatantly obvious when somebody's got bad lip filler. There's filler up to their nose, it's down to their chin. They are just protruding out. Their lips enter the room before the rest of them does. So in that case, it's pretty obvious, and those areas need to be dissolved first. But now cheeks, let's talk about mid-face and cheeks, because there's a lot of bad cheeks out there. And unfortunately, we see a lot of it in some older women or middle-aged women who have been getting filler done for a while, trying to lift their face. And there is a little bit of a misnomer out there that filler can lift. Now, I'm not going to say that filler can't lift, because it can when it is done really judiciously and you are doing volume replacement in somebody that needs volume replaced. Now, you can't just go in and sculpt out a bunch of filler hoping to just fill up dead space when somebody really needs a different type of an intervention, skin tightening or PDO threads, or ultimately a facelift. If somebody needs a facelift, you are not going to give them a liquid facelift with filler and have them come out looking natural. That's just not going to happen. It's not going to age well. So I'm sure we have all seen people walking around with big, gigantic chipmunk cheeks. So their filler seems to go from their under eye almost down past their lips here, or really, really sculpted out into the edges and the lateral zygomatic arch of their cheek. And it's just really all overdone, and it looks way too dramatic and puffy. It gives kind of an alien-like appearance, and you lose that look of being human. So when cheeks are that big, yeah, we should look at doing some dissolving. And what I hear a lot from women that come in that have overfilled faces, have too much filler going on, is they'll come in and they say, you know what? I finally just looked at myself in the mirror and I realized that I didn't recognize myself anymore. And I want to feel like me again. And I hear this from women that are in their 20s all the way up to 60 plus. I once heard an influencer who said, I'd gotten all of this free filler from, influencing for different med spas, and she ended up with an overfilled face that wasn't her. And when she woke up one day and realized that she didn't like what she saw and she missed herself, and she felt like she was looking aged when she was really young and still in her 20s. So if you do too much work too soon, especially when you're young, it can make you look like you're older, trying to look younger. And that's not a good look either. I find that I call that the Bella Hadid effect. And not trying to be throwing a lot of shade, but I use her as an example because I think it's what's been done. Bella is extraordinarily young, but she's had a lot of interventions done. So she looks like she's in her 40s trying to look like she's in her 20s when she's really in her 20s. So you do too much too young, you can age yourself, and not in a good way. So it comes down to migrated filler, too much filler, not feeling and looking like yourself. And there's no other way to describe that, but you know what I mean. If something is done to you and you're like, this just isn't me. Those are other reasons why people are dissolving. Another reason that some people are choosing to dissolve their filler these days is they're looking for something more natural. Now, that being said, filler, funny enough, is pretty natural in asterisk, big old asterisk there. It's made out of hyaluronic acid gel. Hyaluronic acid is a molecule that's in our bodies. It's already in our skin. So while it is technically a foreign substance, it's not wildly foreign. And the nice thing is that it does have that built-in safety mechanism of being able to be dissolved if we want to back that out and start fresh. But it is technically an implant. If we look at how the FDA categorizes dermal fillers, when you inject a dermal filler, you're putting an implant in somebody's face or body. So that implant is a foreign body. If there's a foreign body somewhere in you, your body can absolutely have a reaction to it. Usually immune-mediated. So your immune system can decide that, nope, this filler is not for me. I want it out. And unless you take it out, I'm going to wall it off and I'm going to create this big old nodule. So your body can ultimately take that filler and create a protective wall around it, sometimes calcium-based. It could be a variety of substances. And it creates this nodule effect. So that's when you can get a big, hard bump and it just feels like a piece of calcium stuck in there. Sometimes they can be inflammatory, they can become infected, and they can become red, hot, painful, and just cause a lot of problems, or they can just be not hot, so kind of a cold nodule, as I'll call it. They can happen right away after filler, or they can be delayed onset. They can take anywhere from weeks to months to sometimes even years. There was that huge publicized case on social media. If you are familiar with the aesthetics world on social media, Joshua Davis, a nurse practitioner out of Tennessee, had a very delayed onset reaction from filler that actually landed him in the ICU. So there's a whole wide variety of reactions that can happen from filler, and some of them we're not even really aware of yet. So we don't know how they're going to age with time. how they're going to react with our bodies, what other, they're going to interact with illnesses, inflammation, medication. There's a whole bunch of things that we kind of have a clue about, but a lot of it is still unknown. And for that reason, some people are choosing to either not get filler in the first place because the risk is not worth it to them, or they're backing it out and going for more natural routes. So a big personal preference here as to what you're comfortable with. And that's not to scare you. Josh's case is extraordinarily rare, but it is something that can happen. And that's why if you actually do take the time to read your consent forms the way that you should be, you will literally see, at least in my consent form, that for filler, it says death. I mean, I'm not trying to, scare you out of getting treatments done, but anything that we do here, putting a substance or a drug in your body or a foreign body or an implant, can absolutely cause death in worst case scenarios. So everything that we do in medical aesthetics should be taken really seriously. And these are some of the considerations that people are starting to think about. As medical aesthetics grows in size and becomes so much more broad than it ever has been before, between devices and products and skincare and everything, I mean, it's just a huge plethora of options out there. People are choosing some different ones, things like Botox and fillers that were kind of some of the first things around for injectables. They'll always be popular. They'll always have a place. They'll always have a place in my toolbox. But there's a lot of other options out there nowadays too. So what are some alternatives to fillers for people that say, you know what, the risk isn't worth it for me? Or, I'm a little bit more autoimmune. I don't trust my body to take filler on the way that it should be. What else can I do? Because I don't want to, age poorly and I want to keep up with my skin's health. Well, lucky for you, there are options. And if we look at injectables, there's all sorts of different biostimulators. Now with the biostimulators, if you are autoimmune, we do still have to be very careful with those as well. If you're more autoimmune, you may want to look at more of something that's autologous, something coming from your own body, like PRP or PRF. You may want to skip out on the PDO threads. You may want to skip out on the Radius and the hyperdilute Radius or the Sculptra, because you can absolutely have an immune reaction to those as well. But those are some alternatives to traditional dermal fillers. Now, PRP, platelet-rich plasma, it's been out for a while. Now, I think that there's a time and a place for it, but it's not my favorite thing, mainly because in this day where everybody is adding PRP onto everything, is it truly platelet-rich plasma? No. Most often, you are getting platelet-poor plasma. So if somebody's just drawing your blood, spinning it down, taking your plasma, not necessarily the platelet-rich part, and just smearing it back on your face or, microneedling it into your skin or injecting it in. And yeah, you're getting some, but it's not platelet rich. It's not concentrated. It's not just those growth factors, the whole reason why we're using PRP in the first place. So it's not standardized. It's also not standardized because it's coming from your body at that very moment that your bloodstream being drawn. So there's nothing to say that, we're not testing it to see exactly what your concentration is and how good it is. The older you are, it's probably not going to be as good as a young person. And guess what? You're not getting a young person's blood put on your face. You are getting your own. A lot of health issues with that. So don't be doing that. Ladies, don't bring your daughters to have them give their blood for your face. Just don't do that. Now, the next kind of iteration in the world of PRP is PRF. That is platelet-rich fibrin. So what that is that PRP, which it always starts out as, has now been activated into a fibrin matrix or a little scaffold. It can turn into a gel. It can turn into a more highly concentrated version of PRP. PRP, if you let it sit out, it's going to stay liquid. It has an anticoagulant in it. Whereas PRF does not have an anticoagulant in it, or it has an actual clot activator. So this, you have a very short window of duration if you're trying to use liquid PRF to inject it in for like scalp restoration or under eyes or any other area. If you want it to be liquid, you got to do it pretty quick because it's going to gel up and turn into a clot. It's going to turn into a fibrin clot. Now, there's another type of PRF that's hitting the airwaves here. Now, it's been out for a couple of years, but I feel like recently, even like the latter half here of 2023, Easy Gel PRF is making its way onto the scene and becoming more well known. And I think it's because people are really looking for more natural routes of administration and to be able to rejuvenate themselves using themselves in a little bit safer of a manner that's more natural. Now, the Easy Gel PRF kit, very similar to traditional PRF, except this system also has a heating and a cooling block. So you are taking, mind you, I've never actually done it. I've not done this. So this is everything that I read on it. So you draw the blood and then it goes through a heating cycle and then a cooling cycle. So by the time you're ready to inject it, it looks almost like fat transfer. It's actually a thick gel. So it's a little bit more like a filler. And you inject it like a filler. It's not going to go in like liquid and just be super smoothing. It's going to actually volumize temporarily. Now with this, the protocol is typically doing 2 sessions spaced out about a month or 2 apart. And after that, results will tend to last anywhere from about 4 to 6 months, depending on the person, depending on the place. So where can it go? It can go into lips, it can go into nasolabial folds, cheeks, temples, under eye, basically everywhere where you would put filler for structural volume, you can go in and use this Easy Gel PRF as a replacement. So instead of using a Restylane, a Juvederm, an RHA, any of the other fillers out there, you're kind of making your own. It's your own personal brand of filler. So that's an option. Now there's pros and cons to it. Pros, you're not going to get that big immune response. So if you're autoimmune, it might be a little bit better of a choice for you if you're looking for a little bit of a boost. It's also good if you're not ready to commit to filler yet. It can go in and you know it's going to be gone. Your body's going to absorb it all in about 4 to 6 months. It's going to go away and it's not going to leave a footprint behind of some unknown substance. Now, here's a con, and I'm sure there's an answer to it, and I'm going to do a deep dive on it and come back to you at a later episode with an answer, I hope, is if we look at safety mechanisms. So with dermal filler, traditional hyaluronic acid, if you were to have a complication, a poor aesthetic outcome, a vascular occlusion, any sort of issue, you can go in and you can dissolve it with Hylenex or hyaluronidase, an enzyme that breaks down hyaluronic acid, so it dissolves it away. So when we say getting filler dissolved, it's using hyaluronidase. In the United States, we use Hylenex. Now, PRF is not made out of hyaluronic acid. So if you were to create a vascular occlusion and inject that Easy Gel PRF or any sort of PRF into the skin and block a blood vessel, Hylenex is not there to save you. So it's not going to be there to be able to be injected and dissolve it away and fix the problem. So you're basically just creating a blood clot, right? Because that's what PRF is. It's a fibrin clot. Now, if you were to just have a compression injury blocking a blood vessel, best case scenario, heat, massage, get that blood flowing, you'd probably be okay. If you truly have an intravascular injection and you're putting a big glob of that PRF gel directly into a vein or an artery, you've basically just created a blood clot. And now that can go anywhere that a bolus of filler can go. So you can 100% still cause blindness. You can still cut off blood flow and have an oxygen loss to tissue and have tissue necrosis and death. You could cause a stroke. You could cause a lot of different problems. All the same complications that you can create with dermal filler, you can create with Easy Gel PRF when it comes to vascular compromise. So the scary part with that is knowing that you just don't have that Hylenex sitting in the fridge to go break that up. And as far as I know, thinking back to my medical days, products and medications to our clot busters are a big deal. Is that something that med spas are going to start to carry? Because that's a really big deal. And those aren't things that you can just inject locally to dissolve something. Those are systemic medications that come with a huge risk of bleeding and internal bleeding and brain hemorrhage and all sorts of stuff. So, when it comes to creating an actual fibrin blood clot that you're putting into somebody's skin and face, it is just things to think about. So just don't go into PRF injections with that easy gel that's like truly, truly a clot there, and think that you're just perfectly safe and it's no big deal and doesn't have the same complications as filler. So look at your pros, look at your cons, see what you're comfortable with. But believe me, I mean, I'm super interested in the easy gel system. I know quite a few providers that have brought it on recently, and I can't wait to talk to them to hear how their results are, how the longevity is, how the patients like it. Kind of a nice little try on too. So I look forward to hearing about it, that system, to buy into it. I want to say it's about $4,000, so it's nothing outrageous. Is it something that I'll bring into Ethos? Possibly, but I definitely want to hear from some other providers that are already using it before it's something that, I really choose to bring in. So ultimately, what's my take on all of this? So we know that filler is not going anywhere. We know that people are getting smarter with their filler choices, and we know that there's other choices out there as well. You also never really have to go the route of injectables unless you want to. Now, there's a time and a place for it. If you are truly volume deficient, you need volume to replace volume loss, but there's different ways that we can do it. We can look at biostimulators like Sculptra and Radiesse. We can do judicious amounts of filler, and that's really kind of my key take-home point here, is don't overdo it. There's nothing wrong with dermal fillers. There's nothing wrong with using them. It doesn't make you artificial. It doesn't make you vain. It's taking care of your skin and having healthy aging. You just need to go to an injector that shares your personal take on fillers and aesthetics. If you go to somebody for injections and they themselves are overfilled and look absolutely nuts, there's a good chance that you're going to leave there looking a little crazy yourself. So find somebody that you share an aesthetic with, somebody that will, if anything, undertreat you. That's always my go-to. Is I say to patients that are nervous, I say, I don't want too much. I don't want too much. Don't worry. If anything, you're going to be coming back to me asking for more. I want you undertreated. I don't mind if your friends and family who know you so well can tell that you've had a little tweak done. But I definitely do not want a stranger on the street as you're walking across Farmington Ave in West Hartford to be able to point out of all of the work that you've had done. That's not good injectables. We want you to be subtle. We want you to look natural. I want you to look like yourself. We're not changing you to look like somebody else. When you try to look like somebody else, that's when weird stuff happens. I don't want you looking alien. I don't want you looking like a robot. I want you to look like the best version of you. So that's my personal take on fillers and rejuvenation, is less is more. Go lightly. Use products that you can dissolve if you need to. Personally, I wouldn't touch Bellafill with a 10-foot pole. And there's a lot of providers out there that I do respect that use it, but ultimately it's made out of plastic. And it has the highest risk of some crazy immune reactions, and you can't dissolve it. And it's basically a forever filler. So I don't like forever fillers. That's not something that I want to be putting in somebody's face, let alone myself. If I wouldn't put something in my own body, I'm not going to put it in somebody else's too. That's just my 2 cents on that. But look at your overall aging. Let's look at how you're aging, where the problems are. Filler and injectables aren't just it. We can look at doing things like energy devices, lasers, microneedling. Think back to episode 1 just last week there. You can do microneedling to stimulate a lot of collagen production, help iron out some fine lines and wrinkles, help stimulate some collagen. Using really good medical grade skincare. I mean, that's number 1. I honestly, if you're not using medical grade skincare, I don't even want you sitting in my chair for anything other than a consultation. It's literally like going to the dentist for your cleaning and then not brushing your teeth at home. Good skincare is the foundation of healthy aging and looking good. If your skin is healthy, you're going to be radiant. You're not going to notice that tiny little wrinkle or fold or asymmetry. Speaking of asymmetry, we're all asymmetric. So stop chasing perfection. Stop coming in and saying this part of my lip is just the tiniest bit more than this one, or this is my cheek or my eyebrow. We are all asymmetric. We can do our best to help get rid of big differences, but it's those little asymmetries that actually make you look like you and make you look like a human. If we're too symmetric, we look very odd. And also, it's usually impossible. It's structurally impossible because when we are formed inside of our mothers, we are formed from the back to the front. So the whole center line of our face is basically a fusion line. So we're coming together from the back and forming up to the front. So things don't always go perfectly. They might be a little bit off one way or another. Some asymmetries become more obvious as you get older. Don't chase them. Fix what you can, but don't chase them and try not to focus on it. I mean, I'm asymmetric as hell. I have asymmetries in my lips, in my cheeks, in my brows, in how my muscles move. The asymmetry in my low face is wild. One side of my face, it's like wildly higher. I saw it as a child. When I see pictures of myself as a kid smiling, I can see it. It's nothing that I'm changing. It's nothing that I'm even doing anything about because it's just me. It's how I was made, and I know that if it was something that I really went after trying to make perfect, I would probably end up looking a little batshit, to be perfectly honest. I wouldn't look like me anymore. I'd probably look distorted, overfilled, over Botoxed. I don't need it. We're all asymmetric and it's okay. So remember that when you look in the mirror. Filler is not the enemy, but it's also not your best friend. It's a friend that you need to keep an arm's distance away, that you meet up with every once in a while. Filler's kind of like your toxic friend, okay, if we want to look at it like that. So they're not terrible. You need them in your life sometimes. They keep things interesting. You have a good time with them, but you can't spend too much time with them. Otherwise, things can get weird. So think of filler as that. And honestly, I mean, really everything with aesthetics comes down to find somebody that you trust and that you share an aesthetic with. If you happen to like the overdone look, find a provider that's their aesthetic and that's what they do. To be perfectly honest, if you come into my room and you sit down and you say, I want this really big augmented look, I don't even know how to get you there. I really don't. I really, really don't. Like natural, balanced, that's what I can do for you. I can't give you overfilled, puffy cheeks. I don't know how to do it, and I do that on purpose. That's not a skill that I want. I don't want to be able to do that to you, just adding volume after volume after volume. Know when to say no to things. And sometimes you need to listen to your injector too if they suggest dissolving. If they suggest backing out some of your filler, it's for a reason. And usually the reason why I'm suggesting backing out filler for people is migration, or what you're asking me to do to you now, I cannot do because the filler that you existing have right now is in the way of me being able to give you that result. So if you have perfectly filled lips, they are filled, they're fine, but they're done in a way and you're asking me to do something different with them, there's a chance I need to reverse that filler because the filler that's in there is going to get in the way of me doing what I need it to do. Not all the time, but sometimes. So if your injector is suggesting doing some backing out, starting fresh, listen to them. It's not a totally fun process, but it's relatively quick and easy. It's easier to recover from dissolving than it is to actually get filler put in. So it's pretty quick. We can get you refilled. Just be patient and we'll take good care of you. So is filler going anywhere? No. I think that we are just getting smarter when it comes to filler and how we use it, and are starting to use it in combination with other modalities as well. So that's my take on that. So thank you so much for tuning in to Just a Pinch podcast with me this week. Stay tuned. We'll have another episode coming out soon. Bye.